Good evening and welcome to another Tuesday of talking everything careers and a little bit of life. I want to welcome Dr. Nonhlanhla Mbenenge, who is a virologist tonight, and she's gonna tell us a bit about what she does, and hopefully we will learn a bit more about what virologists are all about. Thank you very much for gracing us with your presence, Dr. Nonhlanhla.
Good evening to everybody. Thank you for the invitation. Yeah.
All right.
Yeah.
I'm not sure. I hope the sound will hold on. There was a bit of bouncing
I
there.
don't know. Yes, I think I'm getting an unstable network. I don't know because I've changed
Okay.
places because I think it should do now. It's unstable. Yeah.
Okay. We'll just play it by ear. If it gets worse, you may need to go back to where you were initially. All right. Without further ado, can you please tell us who you are without mentioning your career?
That's a nice question. Nonhlanhla is a daughter, firstly, of the Most High King. I believe that I'm loved by my father up there in the sky. So I'm a daughter first of my Heavenly Father, and I'm a daughter to my parents, Mr. and Mrs. Mbenenge, Isaac and Sina Mbenenge. I am a mother of two boys. I am a wife to one husband, who's a medical doctor as well and a specialist in anesthesia.
Oh,
I am a sister to two brothers and a sister. So there's there's four of us at home. I am an aunt, different nephews, and it differs in our vernacular because it's a different roles. It's not like in English, we're just an aunt. Because to my sister, I'm Mamkulu, and to my brother's children, I am the aunt. Yeah. And at the same time, I've got different roles in the community. So I'm just realizing how big I am.
how
I'm not
wonderful
put a
is
thought of
that?
how many roles I do. Yeah, there are several roles. Yeah. Besides that, I'm a professional medical doctor.
Oh, beautiful. It's beautiful. I love that you are family centered. You mentioned quite a lot about your family and you went quite far and wide. I really, really appreciate that.
Mm.
Okay, so can you tell us where you're from? Where did you grow up? And a little bit about that.
Interesting question as well. Was born and bred in KZN in a small town called Opongolo. It's the north coastal side of KZN. As you travel from Pitriti, then is Pongola, and then as you pass through going to Onongoma, that side of KZN.
Mm-hmm.
So on there, my mom and my dad met that side. My mom's from that side. My dad was staying with his uncle that side, so that's how I met my mom. But then my father's side was in Johannesburg. So as soon as I was about school age, my paternal grandmother took me. So I came to stay with my father's side in Pimville. So
Okay.
yeah, so I grew up in Pimville, my early stages of primary and until high school life, and then went back to KZN. So I've been between the two, and Johannesburg.
Oh, all right. I actually didn't know that part about you. Uh,
So I was so grounded. Yeah,
okay.
I'm a rural.
And your siblings, were they born this side or they were also born that side?
They were all born this side.
Ah, okay.
Though the boys did have a portion of growing up in KZN,
Mm-hmm.
but I was the only one born that side. Vuvu was definitely an
Is that Joe Becker?
Jamaica, the little one. Yeah.
Righty. Um, and when did you decide that you wanted to become a doctor?
You know, it's funny when I thought of that question, I was taken back as far as my 12 years of age.
Okay.
Um, I remember one of my cousins, that was my dad's cousin, so that we're of the same age, got into trouble because she was starting to have a relationship, and because we were close, so the family thought we all having been naughty, we were being punished, and I didn't understand why I've been punished. And then I went to my bedroom. I wrote a dear God letter. You know, I used to like run away and talk to my father upstairs. So I wrote dear God. I love writing. So I wrote my dear God letter. And in that my dear God letter is I was telling God how innocent I was. And then the next dear God letter, I was telling God of what I wanted. I wanted to have one child and a medical doctor. And I was 12 at that point in time.
Mm.
So as far as I could remember, I've always been wanting to be in the medical field. Though I was channeled as I stayed with my mom at KZN when I went back when I was doing high school and stayed there with my mom's my grandparents, my mom maternal side. My aunt was a nurse, so I think that grounded me to be on the medical field. But yeah, it was a passion from being a young child.
And you never wavered from then onwards.
I never did. I kind of swayed a little bit. I didn't go straight to medicine,
Mhm.
but I've been always in the medical field.
Tell us a bit about that journey. You're saying you swayed a bit. Where did you start and how did you end up where you are?
That's a very interesting one because I was in the university for 10 years. I was studying for 10 years. Yeah, many people don't know about that. My family
Sure.
said,
Why were you studying for 10 years?
that's what I say, I swayed. So when I finished my matric, I applied for medicine. I was not accepted for medicine.
Mhm.
You know, it's one of those fields that is very competitive in terms of admission at universities.
Of course.
Though my results were good, but it was not the A and the B, you know. So kind of needed to fall back to my second choice. So my second choice was nursing. So I
Okay.
was going to start nursing and then probably change. But then as you start and people will hear stories about how medical field is so difficult and you look at people who are A's, got there and they fumbled, then I chickened out. I stayed doing nursing. So I've got a degree in nursing. Yeah,
Oh,
yes, fully qualified degree, not even a diploma, degree in nursing. So I've got a Bachelor of Nursing Science and Art, and then at the same time, I didn't want to do nursing, so I did psychology. So I've got a BSc in psychology.
what?
Uh, yeah, so I was doing nursing simultaneously and psychology. So by the time I finished my fourth year, I had 2 degrees. then then I applied for medicine. So I've got the 2 degrees and medicine. So 4 years plus 6 years, 10 years.
So you passed everything. So you had 2 graduations in 1 year, I'm guessing.
Yeah, though because it was secondary, I didn't attend that grade. I attended the BK one. Yeah, but I've got a BSc psychology. Mm.
Very, very interesting. I guess you didn't practice any of them at any given
I
time.
did do the nursing as I was starting out medicine, because now it took a bit of strain financially, because I think parents, or especially my dad, was supposed to be going to work, and
Yeah.
there's for money, and because now I was already doing the first year in medicine.
Mm-hmm.
So I decided, you know what, I'm gonna venture into part-time nursing, and I realized it was difficult, it was hard. So I did do sessions in that first year, but yeah, only that first year. Yeah.
Sure. Okay. So and then when you went into medicine, you started with first year. You were not credited. Nothing.
Nothing. It's not like now. I think it came back with later years, what they experienced, because I know universities, they've now realized that if you've got somebody who has been grounded and they're bound to complete whatever degree they're doing. So now they credit. But when we started, days, you have to start from that scratch.
Okay. Is this all in the same university? So are you doing?
I did nursing and my psychology and my medicine in what we used to call then Medunsa, the Medical University of Southern Africa.
Yes.
It has changed names now. It's Sipako, the Health Science University. Yeah.
Sure. Okay. That's quite intriguing that you did all of that. And do you find that it was useful for you to do were the degrees that you did useful to what you're currently doing?
They are related. As I'm saying, by the time you go from nursing to medicine, the only thing that is that you're going with a deeper knowledge, but you already exposed when it comes to skill wise, so like ops and gynae, you excel, because I've done midwifery, you've delivered with, but then it's a different expertise now, because now you go you're cutting, you can go and do Caesar, so you're taking to a higher level. So but then you're already exposed to it, so when people are scared and you're kind of like, it's exciting. So yeah, in terms of the exposure, in terms of a basic knowledge, you go there, you're already wiser than your peers.
Okay.
Yeah.
So how then, what happens then from the time you are qualified as a medical doctor to the time that you finally decide you want to specialize?
So for medicine, it's one of those degrees that there is compulsory community service engraved in the component of training. So you've got 2 years of giving back. So the first 2, after you finish your 6 years, you do the internship. You become an intern. So call a junior doctor, junior medical officer. So you're under strict supervision by your seniors, but you're already earning because you're working full time.
Yeah.
And then the following year you have to do community service. So they can send you to any area that the government is in short of medical officers. So you become a medical officer for the government. So you've got 2 years compulsory give back to the community of South Africa. So you did that. I did my internship in Free State Bloemfontein, under the Pelonomi Universitas Circuit,
Okay.
the military, because I was sponsored by the military health services.
Oh,
So yes, so I got a first number. So
you got a what?
first number, the military.
Oh, sounds like you had a really interesting journey, hey?
Gosh, yeah, thanks. So, and I did my community service under the military health service as well. So they're in Bloemfontein. So yeah, 2 years in Bloemfontein.
2
So
years in Bloem. You
yeah,
said 2 years in Bloemfontein. Okay.
my husband comes from Bloemfontein. So at that time he was going to specialize. So, and we just got married. So yeah, we had to go and stay in Bloemfontein.
All right. Okay. So let me see if I get this right. How many years are you in university? The years that you are actually spending in university studying?
10.
No. I mean for the medicine.
Oh, for medicine, it's 6 years.
Yeah.
To do
6.
medicine, 6 years. Full 6 years, yes.
And then after the 6 years, you do your
To internship and community service. It's 8 years.
That's a lot.
That's a lot. But then you're already working when you do your
Internship.
and your com service. It's just that you can't do anything else at that point in time.
Do you think it's necessary to do the community service? Do you think it's worthy for the doctors to actually do that? Is there any benefit to it?
You know, when we are in it, kind of hate it, but with the experience, we always say years comes with you get wiser. It is necessary. It grounds you, and at that point in time, it's open your eyes in terms of the need for the community. We do need doctors, and it's painful that how we neglect the most vulnerable, and we tend to want to be in urban areas, and we forget the rural areas where the closeness of a health center is very far. So
Yeah.
majority of us are concentrated in, we want to live a comfortable life, we want to be close to all the nice things, but who take care of those who are far from the health centers? And that's where we're needed.
So do you find that the community service then helps to bridge that gap?
A lot. So that we don't stay, but the experience stays with us. Yeah.
Right. Okay. So you've now done your community service. What happens after that?
So once you've finished, then you can choose whether you stay as a medical officer, so and what we call general practitioners. Okay. So, and you can open your own practice and become an independent general practitioner, or you stay in the hospital and you just become called medical officers. But so it's one of the same thing, because you don't have a specific specialty. So it's called general practice, because you can be moved along all the other fields of medicine that we trained. Remember, as when you're doing the bachelor's, we move around clinical medicine, we move around surgery, family medicine, and all these departments. That's why it's called general medicine. So you can stay at that level, or you can go and now specialize. So when you found your own niche to where to specialize. Yeah. So for me, I opted for pathology. Okay, I had my reason. It was not a decision that I just woke up and said I'm going to be in pathology, because in terms of when I was still a medical doctor, I didn't think of pathology. Yes, there was something interesting about pathology, because I always think the foundation of medicine is in pathology. But the decision came about when I got pregnant, that pathology will be the it for me. Yeah.
Okay.
Because when I finished medical school, I thought I'd be in anesthesia. Had good results in anesthesia. And other field was obs and gynae or emergency medicine. So those were the places that I wanted to be around. I love surgery, but I think at that time, because I've got tremors, so I
Oh,
kind of like people will make a joke about them. So it made me not to have confidence in myself in terms of surgery. So I kind of, no, let me not be in the field. At least I made mistakes as people, as I'm switching or doing something. So yeah, so I opted
are they
for pathology.
are they bad or
When
or
I'm anxious, yes. But in general, you will not see them. I don't have. It's when I'm in an anxious mode that I will have them, and they're fine. They're very fine. If you're far off, you will not see them. Only when I'm close and you see me being meticulous that you notice that I do have tremors. But it's something that over time, as you get confidence, kind of fade. So I think it comes with the anxiety of
yeah.
wanting to do right. But then they went away. So, but then it was now a field that has shut off.
Okay.
So I wanted to anesthesia and ops. Then I was pregnant with my first boy, my first son, Nonhlanhla, and I was working in Belinomi. It's one of the big academic hospital in Bloemfontein.
Mm-hmm.
And my husband was in anesthesia at that point in time. And I realized that if I stay in the clinical medicine for my child, I would be an absent parent. Because we're in hospital most of the time. And I realized, like, Lord, I do not want my child to be raised by strangers. I want to be there to raise him. I had to meditate on terms of which field would allow me to be a present mother. And pathology was always behind in terms of, because I used to have mentors when my mentors, interestingly, were in pathology.
Okay.
So it kind of like helped me in, to pathology.
Okay, you said just now that the foundation of medicine is in pathology. Can you expand a bit on what you mean by that?
Medicine is able to diagnose what's wrong with a person.
Okay.
If it was not about ill health, I don't think we will be in need for medicine. So people come because they are sick.
Mm-hmm.
So the other fields, they tend to tell you what the probable cause of your disease is.
Mm-hmm.
But pathology is when we now identify what actually is the cause of the disease. So pathology means study of abnormalities. Yeah. So we looking at what is the actual root cause of your problem. So I always say we are the doctors that tell the doctors what's wrong with their patient. And then they become the hero because their patients, they see who is in front of them, but the actual heroes are us behind the scenes.
Doing
Yeah.
all of-
Yeah.
Sure. Okay. Um, so when did you start specializing? Um,
The actual year.
yeah.
Sure. I am now 10 years into the field. So 15 years ago.
Okay.
Yeah. So I'm adding the 5 years because when you specialize, it's a master's level.
Okay.
So 4 to 5 years of master's level.
All right. And what does that look like to someone who might not even be a doctor yet, but thinking they want to go into medicine? What are the years from the day you start university to the day? And I know that in between there'll obviously be breaks. It won't be a straight line. But I guess I just want to know in terms of the number of years where you're actually in school, from the day you start university to the day when they say now you are a specialist.
If we count the number of years, people they tend to say, medicine. You kind of make people not to want to come to medicine. But you've got the 6 years of bachelor, and in that bachelor's includes the honors because it's 6 years of study.
Okay.
So basically, it's like you're doing honors in the program.
Of course.
So that's why we moved from the 6 years to masters. So it's 6 years plus the 2 compulsory give back to the community, which is 8 years. And then the specialization is between 4 to 5 years.
Mm-hmm.
So it's around about 11 years to be a specialist. And it never ends there, to those who are interested. Then you can super specialize, which is another 4 years. And you can do your PhD, which is another 4 years. So, but in terms of level of writing exams, like right now, once you've done your master's in medicine, you've reached the rooftop in terms of examination.
Okay.
So the other they add on if you want to, like then you can super specialize. I've done, besides my master's in virology, I've also done my master's in vaccinology. Vaccinology.
Oh, okay.
So, yeah. And then you can do a PhD, of which I'm studying. I've already started my PhD, just that I've put a halt on it. Because the year was just too taxing for me, so I kind of like paused. So yeah, it's one field that you keep up with what's happening, but in terms of study, yeah, it's 11 years. You can stay at 8, but you'll see in the field you kind of feel like you're not getting it. You're left behind, and you're kind of going in. Yeah.
Sure. Okay. The super specialization. This is the first time I'm hearing about this. I I wonder how many people actually know that there's a level above specialization, because so when you super specialize, do you have to be within the same space, obviously, that you've specialized in?
Yeah.
Okay, yes, you were going to say.
So when you super specialize, that means, for example, I'm in virology. Then I want to go deep into virology. So you choose a niche around the field.
Mm-hmm.
It becomes easier. Let's, for example, if like my husband, he's a super specialist as well, he's a neuro. So he did anesthesia.
Mm-hmm.
But now he's focusing on anesthesia for brain patients. So because those are the long operations. So people have been cut open to the brain. So it's called neuroanesthesia. It's no longer just anesthesia.
Mm-hmm.
So you can go deeper into now a specific area. For virology, it's not that easy. But for clinical, it makes it easy to explain with the clinical. So, because you can do like my husband's a neuro anesthetist, somebody can be cardiothoracic anesthetist. So you kind of choose an area within that field of specialization that you want to zoom into and stay there.
Sure.
Yeah.
Okay, and then you mentioned that you did vaccinology. Is it vaccinology? Is there a reason why you chose that specific route?
Yeah. I'm one of those who believe that we're not created to be sick, and there's an element of preventative that God has given us. And it's in the immune system that we have that element of understanding that preventative side of illness.
Okay.
I'm with infectious disease, of which that's where I'm at. This is only vaccinology applies to infectious disease. So our immune system is able to recognize pathogens, different kind of pathogens, and it's so broad that there is no pathogen that our body cannot recognize. So our body is able to recognize self so intensely that anything that is not self, it can simply recognize and eliminate.
Mm-hmm.
So what vaccinology does is mimic that and able to introduce an antigen that your body will recognize. And our body, interestingly, once it recognizes a pathogen, it formulates what we call memory.
Okay.
That it will always remember that which it had recognized before. And as soon as it comes in, it mounts an aggressive immune response to play it off before it actually does disease. So that's an element that we can utilize in terms of preventing illnesses. So without allowing people to get to the point of being ill and having complications thereof in terms of the illness. Take for example, which people hate so much, the SARS-CoV-2 infection. We realize now the complications associated with the disease for those who have gone through the infection,
Mm-hmm.
how much the body took the toll in terms of clearing that infection. So when we have something that can curb that response so that the body recognize it quicker and deal with it before it complicates, why not? In a safe space, of course. Yeah. We can debate all the nitty-gritties there another time. Yeah.
And then would you say then, or rather maybe could you give me an example of um, a vaccine that has been successful in perhaps maybe eliminating a specific illness or you said you deal with infections, right? Yes. So are there any infections that are known to have been eliminated because of vaccines completely, that is?
So for human disease, we have there's a difference between elimination and eradication.
All right.
So elimination is when you remove the disease in a particular geographical area. For example, in Africa, we have eliminated polio, not seen a case of poliomyelitis, one of the horrible diseases. Well, we'll highlight it a bit later. But then it's still seen in Afghanistan and Pakistan. So the disease is still there. And talking about the wild type. So we have eliminated, but it's not eradicated.
All right.
But we have eradicated smallpox. There's case of smallpox. You can people can go and Google smallpox. You'll see it's like mpox. What is happening now with mpox? It falls under the same family, with mpox. Those nodules that people come with, the nodular rash that is very aggressive to the skin and comes for the whole body.
Mm.
And people complicate thereof from the systemic infection thereof of the virus. So we have eradicated smallpox. And some of us, we've never seen a case except what we read in books. The last case, I think it was 1977. So we have. So the other ones, we have eliminated several of these infectious diseases through vaccines so far. So there is one in eradication and the others are elimination.
Okay. There is a question here. I'm coming back to that. I'm quite interested in what you are talking about now. But there's a question here, and maybe you have answered it to some extent. But the question says, what is the difference between a specialist and a super specialist?
Okay. As when you go into choose a specialty to.
Please say that again. Your sound had gone for a little bit.
Again. Okay, sorry about that. Try to move towards the house. So after you've done your bachelor's and you've choose this area of specialization, that means you choose in the different fields of clinical medicine or of surgery or of pathology, you choose a area that you want to focus on, you specialize in. Okay, so I chose pathology, and in pathology there are different fields in pathology. I chose virology. So you do all the viruses that affects humankind. So there are lots of viruses. Okay. So when you super specialize, that means you choose a particular area in that field that you specialized on to focus, to zoom into it. So for me, because remember in terms of virology, we're talking about there are different areas where you look in terms of the infection and how your body mounts an immune response in terms of getting that infection. There's an arm called vaccines where you kind of mimic the immune system. So now you're going to zoom that, so become a super specialist. So basically you are going deeper to a specialized area and focus on that, then you become a super specialist.
To super special, okay. I mean, this is, I know that it's true, but I guess I just want to know, in terms of earnings, what's the difference between, what's the difference with, what's the difference between a specialist and a super specialist?
Yeah, that's a question that's always boggles mind when you come to when you're a public servant.
Okay.
Because I think in medicine, especially when you're a public servant, it's not about money. Yeah, it's about the love of what you're doing.
Yeah.
In private, yes, because now you have to charge for your studying. As you see, a specialist is not as you see a general practitioner. It's somebody who knows to a higher level what is the problem. Okay. So the charge will be different. If your GP charges 1,000 rand, your specialist will charge probably 2,000 rand. I don't know in terms of the tariffs into private. I'm not in private space. I mean, the public servant. I'm in academia. So, but when you come to the side of public servant and academia, it depends on the number of years you've been into that particular field. You move from being junior to a senior to a principal, and if there's a space, then it can be an HOD, head of department. So if there is not much money that side, So yeah, so most of the time, most people who want to do, they'll go into private practice if you want to make money.
Is there a reason why you choose academia instead of going into private, for example?
Yeah, I love teaching. I love the space where you make a difference. Currently, I'm involved in research, so it gives you that allowance of doing research and you give back in terms of putting strategies in terms of bettering the lives of people. Yeah, whether through teaching or through research. So that's what's kind of exciting for me in academia.
So what does your typical day look like in this space? Or maybe a typical day for a virologist? Maybe you can give us both academia and if you were to be practicing in a hospital, for example, or a private space. What does a typical day look like?
Yeah, when you come to that, they will tell you, those that are in medicine, they will always say pathology, we are doing nothing. I always say until you realize that without pathology, there's a mess in medicine, and we've seen that. When last year when NHLS was hacked and there was sort of like a shutdown in terms of medicine, I think many clinical doctors realized how much pathology was needed, because now patient they didn't know what was wrong with patients. It was just one of those chaotic environments. But anyway, in a typical day of a virologist or in a pathology field, we're looking at lab-based medicine.
Okay.
Pathologists, lab-based medicine. And people will say, what is now lab-based medicine? We are dealing with diagnostic, so biological samples, where the doctor is thinking, okay, there's an infection, but where it is, so thinking, let's say, probably somebody comes with neurological signs, then they will take the sample and they will bring it to the lab. And in the lab, we'll kind of utilize assays or platform to identify what is the actual cause of the neurological problem of the patient, or whatever the biological sample that is related to the disease, and then give the clinical scenario that we have from the lab, what we've diagnosed. We kind of get a picture and we inform the doctor through a report that this would be the cause of disease of the patient. So there's an element of lab-based medicine. So we are in the lab doing the analysis. There is staff, we call them technical staff or technologists, who run the assay, but we come in to make sure that the quality is done, and that means the right sample from the right patient comes to the lab, is tested correctly by a trained person and analyzed correctly, and those results go to the right patient. That's the whole arm of quality management system that we put in place. And as a virologist, I make sure that is up to the standard. And then the analysis of the results. So I have to go in and say, is this the actual cause of the patient based on these results that I have? So they have to analyze that and write a report. So that's in terms of the lab. That's part of my work. And at the same time, there's an academic arm where we have to teach. So we teach from undergrads, different fields of medicine, medical students, nursing students, public health students, molecular medicine students, so different categories of the bachelor's degrees and the honors degrees, the master's degrees. So there's a different levels of components of teaching. And at the same time, we've got the components of research. because we have to do research as well. So that's in a nutshell to summarize my my day. Some days, yeah, like this week is one of those hectic because my honors students need to finalize their research because they are presenting in a week.
All right.
So yeah, so you're sitting, you've gone through the lab with them because you have to teach them lab. You have to go and analyze their own component of research, come back and do a write-up. At the same time, with those students, you need to be in the lab, making sure that the patients, which are the core people that I value, they're getting their results and they're getting them timelessly of the results. So it just one day can be just, taxing. I hope I've summarized it well.
Yeah, it sounds like a lot. So I'm trying to see if what makes sense in my head is actually what you're saying. Would you say that so I'm guessing you see a lot of samples under the microscope and stuff like that, right? Am I correct in thinking that?
So it is like we said, different in different fields. The one who sit under the microscope are the anatomical pathologists because they look at tissue level.
Okay.
So they take a tissue. So to zoom in a tissue, you need a microscope. So in terms of infectious disease diagnostics, it's different. You got platforms that are already get in terms of identifying either the antigen or the nucleic acid of that particular pathogen to be able to identify that causality, or if somebody is mounting an acute immune response, somebody who's acutely infected, that means I get a disease today. So the specific immune response toward the infection, so that can be detected in the blood. So you produce certain proteins, your IgM, what we call the immunoglobulin M's, that we call them, if we detect them, that can indicate an acute infection. So we need a sample, we run it through a platform, and we're able to say, we're looking for this particular protein or looking for this particular gene, and able to disease.
Okay. Your sound is
Technical.
yeah, the sound was going, but I heard what you're saying, although a bit choppy. Do we have a lot of virologists in our country?
The field has grown, remarkably. When I finished my master's in virology in 2014, that's when I finished my master's. There was only 4 blacks who but it was interesting because when we started in terms of training, at that particular time when I did my first year, started in 2000 and came to birth, it was 2009. The first black completed at that particular time. And there were only at that particular time, I think I read less than 10 virologists. By the time we finished in 2014, there was only 4 of us, Black virologists. The field was predominantly white, but we were not even reaching 20 at that particular time. So the field we have gained more Black virologists, but we are in minority. I don't think we have even made it to 40. I'm not sure of the actual statistics because it's different universities training. We've got DGM, Sifako Magatu's training. We've got Wits, we've got Pretoria, Cape Town, Stellenbosch, and the Free State universities. So we've got those different universities training. So, but I do not think we have made 50 as yet. I'm guessing. I'm under correction, but I don't think there are many.
So when you say we are not 50, you mean in total, like?
In total, I'm talking about in total, there's still very few virologists in the country. I'm talking about clinical, but there's a difference between scientists who look in terms of virology, because the PhDs arm of science. They are called also doctors, and they're called virologists. But then there's an element of clinical where we come in as medical doctors who are specialized in virology. So I'm talking about clinical virologists in the country. If you incorporate the both of them, probably will say we are quite a number. But now I'm being specific to clinical virologists. I don't think we are that many. I don't know the actual number, but yeah.
Sure. Okay. And the vaccinologists?
Vaccinologists, I definitely not sure. I know Prof. Madi, very well known, but second, he's a vaccinologist. But to say the actual number, it's one of those areas that in terms of training, we might not also be many. But in the scientists might be quite a number, because people are looking at different components you can do in terms of vaccinology. You can look in terms of actually creating the vaccine element, or one of those who involve in terms on the clinical aspect of it. So I'm in the clinical aspect of it. So I'll be lying is one of those areas that I just was intrigued, because it's part of how our immune system respond, and it's one of those areas that's very intriguing. The immune system.
Okay. Is there something you can tell us that is that we might not know about viruses, like something that's really interesting?
Viruses are interesting. In general, I would say the next pandemic that is coming, it will be a virus again.
Haibo, you are certain that another one is coming.
I am certain, and I am telling you, because it's one thing I always say to my students. We've found a way of how to treat bacteria. Though antibiotics, and we're probably creating a super bug, which we're gonna give us a headache in the future. But with viruses is one of those, we do not have actual treatment when it comes to viruses. We've got what you call antivirals. People who think like HIV, you've got antiviral, but they're not cure. If you look at those treatment that we have with viruses, the only cure for a virus is your immune response. When you get hepatitis B, as an example, hepatitis B, if you get it as an adult, your immune system, because it's strong, is able to be aggressive enough to go into your liver and clear off the infected cells, literally remove them. The skillful way of removing them, the infected cells. Because viruses replicate within the cell. They need a cell to replicate. So they take the cell and utilize it for itself to replicate, make itself copies. And within 24 hours, you've made millions of copies of that one virus. From one virus, you can get millions of copies in 24 hours. And such that it overwhelms your body, and also your immune system, that many people succumb because of that. And the only clearance is your immune response. So after saying that, so if you're an adult, you're able to, in a nice way, clean up, mop it up. But if you get it and you do not clear it up, you become a chronic carrier of that infection. So viruses got a tendency to able to hide from the immune system. They come in, they want to hide because they want to replicate themselves, and then they linger and they cause damage. But because of the immune system, many are able to be cleared off. There'll be those that lingers, of course, who've got hepatitis B, especially when you've got hepatitis B as a child. You're not able to clear that infection, become a chronic carrier. We've got HIV, which also hide from the immune system. By the time it's recognized, it's already integrated into your cell and becomes a chronic infection. So they're just intriguing things, about viruses, that they are very clever pathogens, microorganisms. Yeah. Also made interesting for others. But yeah.
So all you guys can do is to create what vaccines, not you cannot clear them once they're in the system, except for the immune system to do that.
The vaccines are there to prevent, but it's not yet for all the viruses or pathogens, microorganisms.
Mm-hmm.
There must be there's a criteria to be able to say this definitely needs. It'd be nice to have vaccines for all the pathogens so that the immune system recognizes them and clears them off. But it becomes difficult when you've got because most of these pathogen microorganisms, they come from animals. They just cross over to humans because we interact with this with the animal ecosystem.
Yeah.
So there's an overlap between the animals and humans. So such that this pathogen cross over from animals to humans, and sometimes they don't linger along. And take for avian influenza, like flu, come from birds. So they just cross species to come to humans, but they're able to clear them off, but then they remain in birds. So vaccines work when we have less in terms of animals a virus. For polio. Polio is a human virus now. It came from animals, but crossed and became a human virus, such that we do not see it around within animals. So when you have such, where it's a human virus, so when you're curbing it in the humans, you're not going to have it circulating. Okay. And you must have a way to diagnose the disease so that we're able to find it. And at the same time, must have the element of able to prevent it so that it must not linger. So that's where it comes in. So it becomes easy to curb a disease when you've got those things in place.
Okay, you mentioned that another pandemic is coming.
I was just highlighting. I was not.
So are you saying that there is nothing we can do to prevent another pandemic?
So far, we can prepare for it. There's this pandemic preparedness that many of the super organizations, the WHO, and different countries are trying to set up so that we do not find ourselves what would happen with SARS-CoV-2. But I always say, when our preparedness is never preparedness, as we kind of realize that we don't have our dogs in place. And we know, history has told us that pandemic will come. And if you look, we've always had pandemics. From the Spanish flu of 1818 to, which was influenza, and to another influenza in, I think was 1977, I think was the last one. Then we had 2009, we had H1N1 coming in. Now we have SARS-CoV-2. There's always going to be um, a viral infection that will cause a pandemic. So, taken from history, yes, it is coming, and there's nothing we can do about it except to be prepared, or not to find ourselves unprepared, as SARS-CoV-2 caught us unprepared.
Is there anything I can do as an individual to be prepared for such a thing?
I think at the individual level is to keep ourselves healthy. If I can finish what I am saying about this topic, and especially with viral infection, with infectious disease per se, is to keep healthy and take care of ourselves in terms of behavior. What I'm saying that is many of these viruses transmit from one person to another, whether is from sexual, most of the time is sexual transmission of these viruses. Then there's a component of transmission from mother to child, which we can also, if we do precautions, we would avoid shifting the virus from to the next generation. We can have for example, HIV-free generation is possible now. We know. Mm-hmm. We've seen it. It's working. An HIV positive mother having an HIV negative child. So in terms of that, if we not promiscuous or taking precautions, always say it's better to abstain, but there's an element of humanity that doesn't want to abstain, or say take precaution in terms of that. But in terms of the other infections, especially the respiratory infections, it's just keeping healthy. And I always take my patients, when we deal with this, into a program called New Start. And many people do not like to discuss it, but it's one of those programs that had helped even with the SARS-CoV-2. Mm-hmm. I had an experience with SARS-CoV-2 where we're infected with it in the house. And my husband, who is asthmatic, literally was one of those severely hit. And the application of a New Start brought a great return to health for him, because he refused to be in the hospital. So I nursed him from home. Mm-hmm. And applying New Start meaning nutrition, eating well. We eat very bad. So we do not eat nutritiously, and we are indulging badly in terms of eating. We do not have self-control, which also attacks our bodies to some level. And we do not exercise. So obesity has been proven to be a cause of disease, many diseases associated with obesity. So exercise is an element of also that helps in terms of bringing health. Water. Our bodies need water. Our bodies made of water, but we do not drink enough water. Not flushing. Many of us, we think we're drinking water when we are flushing the system, but we are not watering the system. So there's in terms of water, we do not rest. And
before you go on, when you say flushing instead of watering, what do you mean by that?
You know, people work with these big liters of water, and they will tell you that in a day I finish 3 waters, and you ask them how do they drink. They take the water and they drink about a liter, just that one time. And now you go several times, you go and pee. So basically that in and went out. Mm-hmm. So when you water, you sip your water. You know, I always say, watch how people drink their beer. And that's how we're supposed to drink our water. Because when you take in the ground, when people come with a bucket of water, when you spill the whole water, you're basically erogating the soil. Mm. But when you put it in dips, that water flows into the soil, get absorbed into the soil. Yes. So that's how we're supposed to drink. sips of water, and making sure that by the end of the day, you at least drank about 6 cups of water to 8 cups. I will say your pee must be light yellow to almost clear. That tells you that you are well hydrated. So that's what I'm talking about in terms of flushing and watering.
Okay. Thank you very much for sharing that.
So I was thinking
You
about that, and then the S is for the sunlight. We have moved, technology. We've moved with at our houses. We've got garage, so we moved from the house to the car, to underpacking at work, to the office, and work inside a building. Then from at the end of the day, go back to our cars, back to our garage, into the house. There is no period where you go to the sunlight, and we do not know the bad effects that we have not exposing ourselves to sunlight.
Mm.
We need it. In terms of many physiological processes, Jeff, they come from the sun.
Mm.
Then we in terms of your temperance, I've already highlighted. When we overeat, when we oversleep, whatever we do that is not in
Yeah.
excess, it's bad. And that's a news. And the A is for air, which we need. I always say, go outside, walk, and have the element of deep breath.
Mm.
It helps to relax. It helps to help those endorphins that makes your body in a calm state. And we need that oxygen in terms of our survival. And what do I mean? I've already talked about rest. And the last one is trust in God. And I always say it should have been the first one. It's just that it will not fit the acronym. But trust in God is element that when we are people who knows that our bodies is the temple of the Holy Spirit, we know that being disobedient to the health laws, we are being disobedient to God.
Mm.
And that element tells you that you are affecting your body. Because if you take care of your body,
Mm.
and contributing to your Christianity in such a way, because you know that is the temple of the Holy Spirit. And that whole element to makes you to live a healthy lifestyle. And that element of trusting God about your life and living that healthy lifestyle is an element of your spiritual health, your mental health, and also your physical health. So that, in essence, for me, had been a key element that we should be training our doctors, but we do not incorporate that in terms of training our doctors. We incorporate in terms of treating, not preventing. So we have moved from the basis of having the preventing disease to an element of curing disease. And that's how we make money.
Of
Let people
course.
sick and then we make money out of them. Yeah.
Yeah, I actually wanted to ask you about that. You are talking about New Start, and I would imagine that this would take away bread from most of the doctors' tables. How are you then able to talk about that and to instill that in people without feeling like it will interfere with your income?
I believe that there's an element of rebelliousness in us. So you will not be able to take away bread because people will not want to listen. People listening will have less people who are sick. There will always be somebody who's sick who need medical assistance because there are people who live a healthy lifestyle, but they will have disease as well. So I always say now we kindly have in majority people are ill health. We're not supposed to have in majority, but we'll have those that element that need our help. So there will always be those that will never take bread away from medicine because we will always have people who are sick. But then we should not be having everybody being ill. So people who are type 2 diabetics. We should not be seeing type 2 diabetics. We should not be seeing hypertension, especially in the young 30s, 40s people. But I see, and it's coming from our lifestyle. So yeah, there'll be those things that are basics that's supposed not to be there, but they're there because we are not living a healthy lifestyle. But we'll have complicated things, cancers that come from carriers from the wrong genes, exposure in terms of viral infection that affects pregnant women, the child, unborn children that we're going to be sitting with the complications thereof. So there will always be an element of medicine that will never take away from doctors getting their income.
Okay. And with that, I want you to talk quickly about how you, in your space, are incorporating the AI and 4IR, if at all.
So AI has always been there in pathologies that I think we always say we're the first one to embrace AI in terms of diagnostics, lab medicine. The technology we're utilizing to be able to diagnose disease is always AI-based. It's just that now we are incorporating even more into the whole field, especially for my field, is now it moved to in terms of academics. This is AI what we're utilizing right now. So in terms of teaching is AI, in terms of research is AI. So we cannot run away from AI. And it's one of those that we need to embrace and appreciate the knowledge and able to utilize it correctly. Because yeah, it can also be abused.
Yeah, that I think is the problem. There's a message here for you. It says, I must say the career changes are very intriguing, from nursing, psychology, and medicine versus balancing expectations from parents to get a job, vs as a career. The lady's journey is inspiring.
Oh, thank you. Thank you so much. Appreciate that comment.
Yeah, I agree 100% with what has been said. I honestly had no idea that this is how vast you are, and I feel like I didn't even get to cover everything that I would have wanted to. It's amazing how time just moves so quickly when.
I'm realizing that because I was like, you 1 hour. What I'm going to be saying in 1 hour.
Well, you see, we're not. I mean, I can see that you are still fresh. You can still talk for a bit more.
I was working for, as I've highlighted, that my owners are busy with their write-up, their research write-up. So I'm currently reviewing their work. So I slept at 2 this morning, a.m. That's where I was going to bed, because now I needed to finish their review so that they can give them corrections so they could go and do further work on their work. So it's come with the feel. Sometimes I always say there come an element where we put new start in terms of rest aside. Hopefully that the week there we are done so that I can catch up with my rest next week. So yeah, I'm still fresh.
Oh, and you slept at 2. My goodness.
We get those days. We get those days.
Yeah, but I can see your patient and deep-seated love for what it is that you do. I would have loved to go a little bit more into vaccines.
Yeah.
But I think we can curb it here. Hopefully we can talk again soon.
Okay.
And just give us a bit more expansion on this other side, because I feel like the vaccinology is just a subject on its own, and I didn't want to go into that too much, because I felt like if we did, this train was going to run away with us. I am so grateful, Sister Nonhlanhla, for you coming through. I'm amazed by by what you've done. And I mean, I know other things that you're doing, the clinic that you've started, which is more your giving back into the community. I honestly don't know where you get the time to do all of these things and still raise amazing boys.
Thank you.
So I am quite fascinated by what it is that you do, and I'm just amazed by what you've been able to do up to so far. And I really hope that we can get a chance to talk again, hopefully about the other aspects of your life.
Okay. Yeah, what was intriguing people, and I don't understand how much is intriguing. Because for me, I always say it's another can of worms. But it's not a can of worms if you understand it, that we are fearfully and wonderfully made. And that's where, vaccine comes in. But yeah, it's a big topic. It's a big topic on its own. Yeah. So, but I am grateful for the time, and all things are possible. When if there's anything I will tell somebody who have not yet started their careers, there's nothing difficult. As if we put our plans before God, He does amazingly. That's why I'm saying this. For me, medicine was one of those intrigues that I said to God, I want a doctor. And it's amazing that I had to go all the way, and eventually I became one. And the stance thereof is like, I look at it and say how I'm going to contribute to mankind. So if there's anything that people can take, is that whatever you dream of, it must be able to contribute to your community. And once it does that, and you put it in God's hand and put effort towards it, because you have to give in, give.
Okay. Not sure what happened.
I think I've lost her.
Oh, yes, you are back. You're back.
Yeah,
Sorry.
Sorry. I can see that you went off again. Yeah. Sorry about that. But anyway, I hope people have heard that all things are possible. Yeah.
That is amazing. There was a question, but I think they retracted it. The question was asking if we are becoming resistant to antibiotics.
We are seeing superbugs. We call them superbugs. And it's because people are abusing the antibiotics. And once we abuse stuff, we are creating problems. So there is now what we call antimicrobial stewardship, that we put committees so that they navigate who gives the antibiotic, what antibiotics is given to whom and at what dosage, to curb that. So yeah, medically we're trying our level best to curb the superbug, but yeah.
Okay, and I'm developing more questions, but I'm not going to ask them.
Well, we shall it for next time.
Yes, definitely.
Yeah.
Thank you again. Thank you so much for your time. I really enjoyed my talk with you, and I learned so much. I didn't know about the levels that doctors can even go to. Thank you so much for opening us up to those spaces. And yeah, like I said, I really hope we can talk again. You are really an inspiration. And yeah, I hope you enjoy the rest of your evening. Thank you to everyone who joined in today. Thank you for the questions, for the engagements, and we hope to see you again next week. Cheers.